So EvolveX is a body contouring procedure from InMode. Patients who are the best candidates for the EvolveX are patients who are physically fit and they may just have a small problem area or need increased muscle tone in an area. So this may be a patient who, exercises 3 to 5 times a week, no matter how much they diet, no matter clean their diet is, they cut out alcohol, they're doing all the right things in the gym, they may still have love handles, or they may have an area, on their lower abdomen that just isn't quite cutting it with diet and exercise. So those are going to be the patients that will really see the best results. If someone has a large amount of laxity, maybe they lost an extreme amount of weight, or someone is obese, really morbidly obese, and they're looking to shrink down maybe their stomach or their love handles or a certain area on their legs, this is not the treatment for them. So if we have a patient who comes in who's fairly insistent on receiving a specific procedure, we will go over risk versus benefit. We can tell them, the average amount of maybe skin tightening or fat reduction with this body contouring procedure. If I strongly believe that they are not a good candidate, often I will steer them possibly to another procedure, but I am always very honest and will let them know that they are not a good candidate. I don't believe that they will see results that they'll be happy with. And there may be procedures that maybe either another med spa or a plastic surgeon's office offer, or it may be an appropriate time to discuss possibly even weight management services. But it really depends on the patient, kind of gauging it in our consultation. Is that an appropriate conversation? Is this someone who really struggles with body dysmorphia? You have to be a little more gentle with that patient, but I always strive for patient safety satisfaction. If we perform procedures on patients and they're not appropriate candidates or they don't get the results they want, they're not going to be happy. We're going to have horrible reviews. But really at the end of the day, I'm not going to be able to sleep at night if we have patients coming in here who are really unhappy. So we just have to be open and honest with our patients, and we can always see them in follow-up and make recommendations.